Let's discuss the diagnostic criteria of metabolic syndrome. This was a question asked in INICET November 2023, which makes it an important previous year question. Let's discuss it now. Metabolic syndrome is diagnosed based on the NCEP ATP 3 criteria, which is the National Cholesterol Education Program and Adult Treatment Panel 3. Over here, 3 is the key. Let's look at 5 threes that we need to know to simplify and understand this score better. The first 3 to know here, as we discussed, was the ATP 3. The second 3 to know would be that we're going to be measuring 3 types of parameters: the body measurement, clinical measurement, and blood investigations. These are in the order of how we take a clinical assessment, or even in the order of least to most invasive. Let's look at them. The body measurement would be the waist circumference, which in metabolic syndrome would increase or would be found to be higher. Clinical measurement would be blood pressure, which would indicate hypertension, and 3 blood investigations where we are going to see increased triglycerides, increased glucose, and decreased HDL, which is the good cholesterol. So what we'll find in a patient of metabolic syndrome would be a higher waist circumference, a higher BP, high levels of triglycerides and glucose, and a low level of good cholesterol, which is the HDL. And out of the 5 parameters that we have just talked about, 3 or more should be positive for a patient to be diagnosed of metabolic syndrome. Not a part of the diagnostic criteria, but albuminuria can be seen in a patient. The criteria for which is albumin is to creatinine ratio is more than 30 milligram per gram. And finally, a miscellaneous point is that the hepatitis C virus genotype 3 is associated with metabolic syndrome. So 3 is the third alphabet and genotype 3. So these were the 5 threes that we were supposed to know over here. Let's go ahead with the score. So to diagnose metabolic syndrome, which is also known as syndrome X, we need 3 or more than 3 of these 5 criteria to be positive. The first one is central obesity. The body measurement that we had just seen, please note here that this is the central obesity, which is the waist measurement, not hip measurement. This was the question that was asked in INICET 2023 November session. In males, the central obesity of waist circumference would be more than 102 centimeters. In females, it would be more than or equal to 88 centimeters. The second point in the criteria is hypertriglyceridemia, which is more than 150 milligram per deciliter. The third criteria is low HDL. In males, it's lower than 40 milligram per deciliters, and in females, it's lower than 50 milligrams per deciliter. The fourth point in this criteria is hypertension, where systolic blood pressure would be equal to or more than 130 millimeter of mercury, and diastolic blood pressure would be equal to or more than 85 millimeter mercury. The fifth point is basically an increase in glucose. It could either be fasting plasma glucose more than 100 milligram per deciliter, or the patient could be a known case of type 2 diabetes mellitus. So the criteria says that other than central obesity and a higher blood glucose level, either the patient could be positive for these values, or they could be a known patient for these cases and already be on a pharmacological treatment for any of hypertriglyceridemia, low HDL, and hypertension. Not a part of the criteria, but microalbuminuria can be seen in a patient of metabolic syndrome. More than 20 micrograms of albumin per minute, or albumin creatinine ratio of more than 30 milligram per gram. The point to note here is that central obesity is waist circumference and not hip circumference. And also to note that this is low of the good cholesterol or HDL, and it's not LDL. Just a point to note that metabolic syndrome plus obstructive sleep apnea, which sometimes can be seen in a patient with obesity or metabolic syndrome, is known as syndrome C. That's it. Thank you.